Okay, so first I'm gonna check the order for the patient and check to see if they have any allergies. Then I'll assemble my supplies and assess my patient. Then I'll wash my hands. I'll introduce myself to the patient and identify them using 2 identifiers. Then I'll provide for privacy, and then I will explain the procedure. After the procedure's done, I'll evaluate my patient, and then I'll educate my patient. Excuse me. So I have an order for acetylcysteine now. So I would go ahead and assess the lung sounds, or my patient's lung sounds, and then I would go ahead and administer that medication according to the MAR. And then, so after that it says tracheostomy suctioning every 4 hours and as needed for airway maintenance, and then routine tracheostomy care for every 12 hours. So first I'm going to do the tracheostomy suctioning. First I would wash my hands. I'm going to open my kit here. Sterile blood out. Okay, so throw that away. So first I'm going to set up my little basin. Now I'm going to get out my tubing. Alright. So I'm going to hold the tubing in my dominant hand, and I'm going to go ahead and first I'm going to check the label on my saline and make sure that it's in date. I'm going to hold the label in the palm of my hand, and so this hand's not going to be sterile anymore. So I'm going to fill my basin up with the sterile saline. And since this hand isn't sterile, I can hook the tubing up to suction. I would not bend over like that in real life. So I'm going to hook this up to suction. And then I'm going to lubricate my tubing with sterile saline. I'm going to come over to my patient, and I'm going to stick the tubing in the tray. Before I do this, I would have hyperoxygenated them for about 30 to 60 seconds. So I'm going to pull the tubing out now, twisting it. I'm going to suction for no longer than 15 seconds at a time. And then I'll rinse out my tubing with the sterile saline again. And then come back and continue suctioning the patient, making sure to take at least a 30-minute break or a 30-second break in between each pass, and the whole procedure to be no longer than 5 minutes. So I would keep doing that until there were no more secretions or the 5 minutes was up. So I'll disconnect the tubing. I'll put that tubing in my dominant hand. Take my gloves off and throw that in the trash. And then I'll clean my mess up over here. Throw it away, and then I'm going to wash my hands again. So now I'm going to do the routine tracheostomy care. Supplies right here. So first I'm gonna wash my hands and put on clean gloves. Those are my sterile gloves. So I'm gonna open my little container here. So first I'm going to get out my drape. Okay. So now I'm going to dump all my contents of my box out onto my sterile field here. And then the things that didn't land inside the sterile field, I would throw away and get a new one. For the video sake, I'm going to pretend that this did not, because I have to have this. This is my only one. So now I'm going to take out the first I'm going to, I have 3 different little sections here on my box. So first I'm going to fill this big container up halfway full with sterile saline. I would check the date on the saline and put the label in the palm of my hand and then pour it. And then these other 2 smaller sections up here I would fill with the sterile saline. And then the big section I would fill the rest of the way with hydrogen peroxide, making sure that the date's good on the bottle and the label's in the palm of my hand. Okay, so now I'm going to take out the inner cannula, making sure to only touch the outer portion of it. I'm going to put it in the big container that's half peroxide, half saline. And then I'm going to take off this old bandage, and I'm going to throw the bandage away, and according to the policy, or the facility's policy, I'm going to take off my clean gloves, throw those away. I'm going to wash my hands, and then now I'm going to put on my sterile gloves. Okay, so now I'm gonna try to adjust my hand here. Okay, so now that I'm sterile, I can work inside my sterile field here, so I'm gonna separate all my stuff. Okay. So I'm going to take my inner cannula here. I'm going to clean it using this. Alright, and now that it's clean, I'm going to let it soak in just the regular saline and rinse off. Okay, so now that it's rinsed, I'm going to pick it back up and I'm going to dry it off. I'm going to dry the outside with just the gauze. Okay, and then I'll dry the inside with the pipe cleaners. And so after it's clean, I will put it back in. And Okay, so once the inner cannula is back in, then my sterile procedure is over. I'm going to still try to keep it as clean as I can. So I'll take my little cotton swabs and dip them in the sterile saline that hasn't been used. And I'm going to clean, right, like once and then throw it away. And I'll clean under the faceplate. And then I'll make sure there's no secretions on top of the faceplate. Clean around it. Okay. And throw all those away. And then now I'm going to put on the new tie. So then once that one's tied on, I'll take the old one off. And then I'll make sure that I can fit at least a finger or two underneath the new tie so that it doesn't choke the patient. And then I'll put the new bandage on. Making sure the slit is like towards the patient's head. Here we go. Alright, and then after that, then I will clean my mess up and take my gloves off, wash my hands, and then I will document how the patient tolerated the procedure.